မြန်မာပြည်သားတိုင်းဟာပကင်းနေဝင်တဲ့အလှပကိုကြည့်ရှုခန်းစားဖို့အတွက်လူတိုင်းထိုက်တန်ပါတယ်ကလေးတိုင်းဟာသူတို့ရဲ့အမေရဲ့မျက်နှာကိုတွေ့ဖို့အတွက်ထိုက်တန်ပါတယ်လူတိုင်းဟာအမြင်အာရုံရဖို့အတွက်ထိုက်တန်ပါတယ်မင်္ဂလာပါ I'm Dr. On. I'm cornea surgeon here in Myanmar.
My name is Dr. David Hunter-Cherwick. I'm the Vice President of Clinical Services with Orbis International. I am based in their New York headquarters, but today I'm in Mandalay, Myanmar with the Flying Eye Hospital team getting all our patients seen. The screening clinic is a really important day. It's where our volunteer faculty meet the local doctors. They discuss all the patients that they've been seeing on our CyberSite telemedicine platform, and they discuss each case and decide which cases we'll be treating throughout the week, both here at the local hospital and on the Flying Eye Hospital. It's almost like a family reunion with Orbis coming back to this hospital where we've worked before.
If someone visits us and see, they might think it's an act, but it's really for real. We're like a little happy family.
I was once told you can't pick your family, but you can pick your tribe, and the Orbis tribe is a very powerful thing. Orbis really is the Flying United Nations. We have people from over a dozen countries working together, and to me it's the best example of functional diplomacy I've ever seen.
I think one of Orbis' real strengths is that we are a collection of like-minded individuals, but from so many different cultures and backgrounds. I think we don't bring one set of ideas, we bring a whole raft of ideas that we can share, and if we can give some good ideas and change some practice for the better, then it makes the trip worthwhile.
Orbis really was the brainchild of a very famous ophthalmologist, David Payton, and he had this idea of putting a hospital on a plane to show the world new technologies to give people their sight back. The DC-8 first generation Flying Eye Hospital took flight in 1982. It's amazing to see how far we've taken not only our mission, but the technology in the plane. The current plane is literally 3 times as big as the DC-8. The classroom was 25% of the classroom today we have on board the MD-10 aircraft Flying Eye Hospital. What's even more exciting is it's no longer a classroom, it's a broadcast studio. I am sure when they took flight in 1982, they never thought they'd be doing live streaming through CyberSite and having people from all over the world watching what was happening on the plane. We have country offices around the world that are doing multi-year projects, whether it's building pediatric hospitals in India or helping remove trachoma, which is an infectious cause of blindness in Ethiopia. We have fellowships where we take the best of the best and have them work with great professors and see new systems. Today, the Flying Eye Hospital is only 20% of our portfolio. Orbis has always been a thought leader on how to combine training and technology. We have artificial intelligence, and simulation is really our future and something that we're very proud of that we spread on the world, not just on our plane, but with our long-term programs.
The Orbis program is able to update so many doctors in one time. My name is Dr. Yelwin. So previously I was an eye surgeon. Now I joined as the mayor of Mandalay in April 2016. Orbis International. I landed first in Yangon International Airport in 1991. That's the first time. For the Project Orbis, the main objectives is not to treat the patients, but to train the ophthalmologists as well as the nurses and the technicians, and including every corner of the ophthalmological society.
One of the things, we're not about showing off, we're about showing how. And so we're going over the case clinically, but then we're discussing the basic science, we're discussing the surgical planning, the differential diagnosis. So it really is exciting because there is an art to medicine and there's the science, and we're teaching both. And we're leveraging both, the best teachers from around the world as well as the best technologies from around the world.
We all want to help patients and to give some benefit to the patient, but the thrill for me, really, of working with Orbis is that we meet our fellow professionals who are working in a very different environment to what I'm used to working in. They have a lot more challenges, There may be financial, there may be all kinds of challenges, probably that I can't even understand, but we get a chance to work together and for me to look at how I can help and how Orbis can help them do their job in a safer and more successful way. And that's the buzz for me.
Orbis picks partners in which they can continue what we've taught them. So in some situations, a doctor would come to a developing world and do a lot of cataract surgeries, but then they would leave and there would be nobody there to be able to replicate or do the follow-up for those patients. But Orbis takes a different take, and it's not about the volume of surgeries that's done. It's about getting the trainees to actually do parts of the surgery under the supervision of a surgeon so that they can continue to be able to master this on their own and continue the surgeries after Orbis has left.
We have altogether 12 nurses, and week 1, 6 nurses will work on the plane and 6 at the local hospital with Orbis nurses, and week 2 we will swap them around. So they will get experience on the plane with our equipment, and we will work with them in their own environment to enhance the training they need and all the equipment they have.
Orbis has been here a week, so I'm with Dr. James Lehman, cornea surgeon from Orbis teams.
I had the pleasure of working with Dr. Ang, who's a very experienced cornea surgeon here in Mandalay. We were able to introduce some new surgical techniques that they don't really use that much here that allow him to treat some patients less invasively and get better results faster. So he was excited to learn those new surgical steps.
Dr. James doing the new techniques, and this technique is not familiar with me, so I learned a lot from him.
It changes the mindset of the ophthalmologists. It's a starting point for the revolution in the ophthalmological society here in Myanmar. Orbis opens the eyes of the ophthalmologists. After they got the training and after they have experience in the field, they are able to train the new generation and the new generations.
To me, it's a vulgar anachronism that we have people needlessly suffering from blindness all around the world. That 75% of that blindness could be prevented or cured, and 90% of that is in the developing world, and this number is growing. And those people are hit with 2 things, poverty and blindness. And with one 5 to 10 minute surgery, we can break that vicious cycle, give them their sight back, enable their families to get back into society, put that money and those earning powers back into the community.
We're continuing to see globally an increase in the prevalence of blindness and visual impairment, and we're going to continue to see that, especially as our population ages and continues to grow. And unfortunately, the amount of healthcare workers that can treat and prevent blindness are not growing at the same pace.
Public health officials have forecasted that the world's visually impaired population will triple by the year 2050. That could be scary for a lot of people. For me, that's what gets me up in the morning. Because at Orbis, we're already working on these solutions. We have amazing collaborations. We have the best in training, and we're bringing out the best in technology and innovation. And what we need now is to grow those resources, build on those relationships, so we deepen our impact and go to the places where our help is needed most, to the people in greatest need.
And today we check Mr. Pumong, he's 83 years old patient.
This 83-year-old man who was blind in both eyes. One eye he'd been blind since childhood, and the other one for the last few years, both from trauma. When they brought him into screening day, they had to walk him in. He couldn't even navigate the rooms or anything. And so yesterday we did a corneal transplant and a cataract removal, and this morning he could see enough to take care of himself. Obviously with a corneal transplant, it takes some time to get proper vision, but even on post-op day 1, he was able to get around. I think it's gonna add quality of life for him to be able to see his grandkids, his great-grandkids, live the rest of his life with more pride and dignity, able to take care of himself.
In today's world, you hear a lot about what a moonshot is. And for some, that's reaching Mars. For me, what I want is everyone on this earth to be able to see the moon at night, to be able to see their kid's face, or be able to see their loved ones at a dinner table. That's my moonshot. All the solutions are in our hands. We just need to globalize those. We need more support to get these to the people in the world who need our help most. And what I really am excited about is how more people are becoming aware of our mission, realizing that we do have amazing opportunities at Orbis to remove avoidable blindness on this planet.